Heart disease is the leading cause of death for men and women, but what you should know is many risk factors associated with having a heart attack are tied to your lifestyle, and they can be prevented. Dr. Michael Liston of St. Mary's Medical Center explains in today's Aging in Style.
Barriers to cardiac care to the general population include a lack of understanding of risk factors that lead to coronary artery disease or stroke. I think my mission is to reach out to the community and educate them on what these risk factors are and have them assess themselves for what these risk factors are. Do you have hypertension or take medication for high blood pressure? Do you have high cholesterol or take medication for high cholesterol? Do you smoke? Do you have a family history of coronary artery disease, or do you have diabetes? And those are considered the major risk factors for coronary artery disease. A lot of people go through life with these issues but don't really put the pieces together to determine whether or not they are at significant risk for coronary artery disease. And then we spend a lot of time in the hospital taking care of the heart attacks and strokes that hopefully in the future we could prevent with risk factor modification. So if you're assessing yourself for risk factors and you're going to go see your physician will want to know, do you have these risk factors, and have an accurate assessment of that. He'll want to know, are you having chest pain with activity? Do you get short of breath with rest? Are there other times you might get short of breath, laying down at night or waking up in the middle of the night short of breath? And all of these things are sort of to determine whether or not you have symptoms which suggest that you already have coronary or cerebrovascular disease. Your physician may also order tests to determine whether or not you've already had the establishment of coronary artery disease or atherosclerosis. Almost certainly they'll have an electrocardiogram performed in the office, which can give them an idea if you have any strain or prior heart attacks or heart dysfunction. More specifically, they may order a coronary calcium score, which is a useful test to see whether or not you've had the development of atherosclerosis or plaquing in your coronary arteries, which again would help us be even more firm about those risk factors and modifying those. He may even order a treadmill stress test or a chemical stress test based on the symptoms that you report. Once you've met with your physician and you've determined what your risk for coronary artery disease is, he may recommend medications for blood pressure, for diabetes, for cholesterol. He almost certainly would recommend smoking cessation if you're a smoker. Once the testing is done, the medication's prescribed, the other things that we can do obviously focus around a healthy lifestyle. My patients often come to me and have questions about diet and exercise. Certainly I recommend exercise to the level that they are able to achieve. Diet is also very important. We tend to eat too many processed foods, too much carbohydrates, and so that can affect our blood sugars and our blood pressure. So it's worth working with your physician or even a dietitian on dietary changes. Coronary artery disease, cerebrovascular disease, and those things that could lead to heart attacks or strokes is a process that takes years or even decades to develop. For the person who comes into the hospital with an active heart attack or stroke, this began many years or decades before the actual event. And so I think that's why I focus on risk factor modification as being such an important element in taking care of our health.
Great info there from Dr. Liston. You can find more stories just like this at kctv5.com and just click on Aging in Style. You can also visit stmaryskc.com.